Welcome. Today we'll be discussing global oral health with the help of a distinguished guest, Dr. Hyewon Lee. Dr. Lee holds a dental degree from the Harvard School of Dental Medicine and earned both master's and doctoral degrees in public health from the Johns Hopkins University School of Public Health, specializing in maternal health policy and management. Dr. Lee is a board-certified pediatric dentist in both the United States and in Kenya. She currently directs the Global Maternal and Child Oral Health Center at Seoul National University in South Korea. From 2021 to 2024, Dr. Lee chaired the World Federation of Public Health Associations Oral Health Working Group, fostering collaboration among national public health associations to integrate oral health into primary health care. Dr. Lee's expertise bridges clinical practice and public policy. Previously, as a public health officer in the United States Department of Health, she worked with public health experts in developing national oral health programs and guidelines with a focus on maternal oral health. Recently, Dr. Lee secured a South Korean development grant to strengthen Kenya's workforce capacity in the promotion of maternal and child oral health. I know Dr. Lee well, so I'm going to call her by her first name, Hyewon. We're good friends, and I have an enormous regard for her work. And as we begin, I want to say, for those of you interested in global health, Dr. Lee and her career to date are a really wonderful role model for many of you. So let me begin by mentioning now the session objectives. By the time you finish this session, you should be able to discuss at least the basics of the importance of oral health to global health, the burden of disease of oral health conditions, critical measures that countries can take to address oral health issues, and how countries might cooperate globally in the oral health field. To help us answer these questions and prepare you for meeting these objectives now, let me turn to Dr. Lee for some of her comments on 4 or 5 questions that I'll raise for her. So, Hyewon, if I might, let me begin by asking, why should learners who are interested in global health be interested in oral health?
Great question. Let me give you 3 compelling reasons why anyone passionate about global health absolutely needs to care about oral health. First, your mouth is connected to the rest of the body. We somehow created this invisible artificial divide between oral health and general health. We have a dental school and medical school. We have dental insurance and medical insurance. But our mouth is literally connected to everything else. And good oral health is a fundamental for eating, breathing, speaking, and has been linked to heart disease, diabetes, and also birth outcome. So major oral conditions such as dental caries and severe gum disease called periodontitis also share common risk factors with major non-communicable diseases such as poor hygiene, nutrition, alcohol consumption, etc. So it is lifestyle-centered conditions. Second, oral diseases are simultaneously the most common, the most neglected, and one of the most expensive diseases worldwide. We are talking about 3.5 billion people affected globally, nearly half of world population. And since 1990, the first year of oral disease data available from the GBD data set, oral diseases have consistently been the most dominant health conditions globally. Untreated tooth decay alone affect about 2 billion people on the earth. But here is hope. Most oral diseases are completely preventable and treatable. Simple intervention like fluoride and basic preventive care can make massive impacts in resource-limited settings to improve oral health.
Hyewon, thank you for this exceptionally compelling comment and the beautiful way in which you've made it. You you gave us some indication of the burden of disease of oral health, but I'd welcome your saying a bit more on that. How big a burden is this, are oral health conditions? And among the oral health conditions, which are the most important?
Absolutely. There are big four oral health problems globally. They are untreated tooth decay in adult teeth, permanent teeth, untreated tooth decay in primary teeth, the baby teeth, severe gum disease, periodontitis, and complete tooth loss, which is called edentullism. So these are the four major diseases, oral diseases in the world. So let's look at one by one. Untreated tooth decay in adult teeth affect about 2 billion people. That's 1 in 4 people on the planet with untreated cavity right now. For the tooth decay in children, there are about 500 million cases. Young children suffering from painful, preventable infection that affects their growth and ability to learn. Severe gum diseases called periodontitis, there are about 1 billion cases of serious infection that can lead to tooth loss and is linked to heart disease and diabetes. Complete tooth loss, edentullism, there are about 350 million people have completely lost all of their teeth. And imagine living without any teeth. How can speaking, eating, and interacting with others are affected by that? Now for the economics. In 2019, that 1 year alone, the world spent 387 billion US dollar directly on oral health problems. Add in lost productivity. We are looking at another additional 300 billion USD dollars globally for that indirect care. That's massive. Massive spending on largely preventable diseases.
Thank you for another beautifully made set of comments. It's hard for me to believe after this that people won't be able to meet the session objectives and won't understand very well the important points that you're raising. Let's break this down, though, a little bit more. When we look at the global burden of disease of oral health conditions, who is most affected? Is it rich people, poor people, urban people, rural people, majority people, minority people, man, woman? Tell us a little bit more, if you would, about who is most affected.
That's a very, very important question. This is where oral health disparity becomes really frustrating. The 2019 Lancet report showed that there is massive oral health inequity. The inverse care law, where people who need services the most have the least access. In high and middle income countries, oral health services cluster in wealthy urban neighborhoods, while vulnerable communities are left behind. In low-income countries, it's even worse. Most professionals are in cities, completely out of reach for rural population. It's both shortage and maldistribution of dental providers. The people hit hardest are rural communities, low-income families, indigenous population, people with a disability, and anyone living in poverty. With oral health, this neglect is even more pronounced than other healthcare areas.
And given the large burden of disease and the extent to which this so frequently affects people who are living more marginally, which is an exceptionally important topic throughout this course, what are some of the most important measures that countries can take to try to reduce the burden of oral disease within their own country?
Mm, we really need to reposition and rebrand oral health as primary health care. I think that's the only way. So when someone walks into a community health center, oral health screening should be as routine as checking blood pressure. We need to train the existing healthcare workforce, dentists, dental hygienists, dental therapists, but also nurses, community health workers, primary care providers to deliver essential oral health services to the people that we want to serve. And this would multiply our workforce capacity dramatically. So when we think about dental care, it's not just aesthetic, complicated crown, bridge, and all that, which is important still. But we're talking about essential, primary oral health care services to be covered under universal health care coverage. So essential oral health services that prevent most common oral diseases should be available to anyone and everyone without financial burden, just like vaccines and maternal care.
Um, and in many respects, I mean, as you mentioned, and perhaps I should have said it even more strongly at the beginning. I mean, in many respects, oral health has been neglected, uh, both by individual countries and by the global cooperative as a whole. So even in these very challenging times for global cooperation for global health, uh, could you say a little bit about how is it that different countries can work together to try to
Mm,
reduce the burden of oral health conditions in those
mm,
countries where it's most difficult to achieve?
mm. Great question. For this momentum, global oral health momentum that we just started a few years ago, WHO is definitely the leading the charge and putting oral health on global agenda so well. Recently, the General Secretary of WHO stated that no health without oral health. That was very, very powerful. And we have organizations like International Association for Dental Research driving the science, and then the World Dental Federation, FDI, mobilizing dental professionals worldwide and driving policy changes to promote oral health. Now, I think the key in success factor here is to collaborate with non-dental organization. We need to integrate oral health agenda into a bigger health agenda. So it's not just dentists talking about this, but it has to be a bigger global health communities. So for example, I've served World Federation Public Health Association for the last 12 years, and that organization is bridging oral health with a broader public health community, which is amazing. And also, I started my own NGO called IDA Society after seeing the need of technical guidance and also learning network between oral and bigger health organizations to elevate the need and importance of global oral health agenda. Another example, I built a center, Global Maternal and Child Oral Health Center here at Seoul National University, to piggyback on what MCH community did so much for the last few decades to integrate oral health into maternal and child health care system. I think we are finally at the tipping point where oral health is getting recognition as a fundamental health care and basic human right. And at this point, we really need to be friends and colleagues and collaborator with non-dental, non-oral health community, even non-health communities like education sector and others to really elevate oral health in a way that people and community can perceive the importance.
Uh, Hyewon, thank you very, very much. I'm especially grateful that you would join us at such a late hour in Seoul. It's 10 p.m. in Seoul, although it's 7 o'clock in the
No
morning
problem.
where I am. But I'm very, very grateful to you for joining us so late. I'm very grateful to you for all that you've helped me to learn and understand about the importance of oral health. And I'm sure that those who watch this, the learners in our course, uh, now, thanks to the very, very articulate and very clear and simple way in which you've responded to my questions, I'm sure they now have a much better understanding than they did before about the
Mm,
importance of oral health to overall health and global health, the burden of disease of oral health conditions, who is most affected by them, some of the key
mm,
measures countries can take to reduce their burdens of oral health conditions, and how it is that global actors can work together cooperatively to support this work. I'm extremely grateful to you for joining me and for, again, the really wonderful way in which you've responded to my questions. And I hope the learners will take your message to heart, will put oral health high on their agenda in their effort to understand um, critical issues in global health. And I hope that they'll carry forward the important messages that you raised today. So thank you, and I'll look forward to very much keeping up with you and continuing to learn from you in the hopes that I might be able in my own work to help spread your important message as well.
Thank you so much for inviting me. And this kind of session means a lot for our oral health community. So, on behalf of our oral health colleagues, thank you so much.
Pleasure entirely. I'm deeply grateful to you.
Thank you.